Hey guys, welcome to the podcast. I'm excited. I have two guests today. I have Gina Cooper, Regional Medical Affairs Director at Crinetics, and Karsten Schnattwinkel, Senior MSL at AstraZeneca. And we're going to talk about the struggle for KOL access and FaceTime, which I know you guys are going to love. This is like a topic I've been dying to talk about for a while because we haven't talked about it in a minute. And it's so important and so relevant. Before we get to that, I just want to give you guys a quick reminder that there's still time to sign up for AI and Medical Affairs. It's a conference coming up January 28th and 29th through Momentum Events. Go to my LinkedIn. You'll see all the information in there, or go to aimedicalaffairs.com. It's in Philadelphia. I'll be there. I hope to see you guys. It's going to be a great event. And guys, let's get into this. So this topic came up. Actually, I was at a conference and someone mentioned this to me. And then I reached out to Gina and I was like, hey, Gina, what do you think? You want to do this? And she's like, yeah, let's do this. And then she called Karsten and Karsten's like, yeah, I want to do it. So you guys excited? You ready to go?
Yes.
Awesome.
Absolutely.
Good stuff. Well, let's jump into it. So Gina, what would you say are some of the biggest challenges MSLs face today in securing access to KOLs compared to, like, let's say, pre-pandemic times?
So there's several. I mean, the KOLs, I think, have shifted their scheduling. So you see a lot of times, like where they used to have administrative hours in their offices, those are now taken at home. So to have an availability to have an appointment, that shifted things. Virtual Congress attendance means you don't get that face-to-face interaction and you don't always have those opportunities. And I think just as physicians get busier and busier and busier with their scheduling, it means there's less time to meet with anyone outside of their organization.
Mm. Karsten, anything to add?
Yeah, I couldn't really agree more. I think there's also like a competing number of digital resources available to KOLs that, somehow competes like with the value that MSLs also like provide. And that also like puts additional, time on their agenda to just like catch up with what is happening. And as we all like felt due to the pandemic, our workload with virtual engagements and being on the road, face-to-face interactions. I think physicians also like face similar evolvements. They have now also telemedicine available. So again, the workload in particular with those folks like in the community has been exploded. And so that definitely like reduces some of the time that we have to talk to them.
Yeah, and that was like my next question. Like, is that really the issue? Like, how has this shift to virtual engagement impacted the way MSLs interact with key opinion leaders? And what is that just an expectation from certain KOLs? Gina, what do you think?
I mean, the virtual in a way it's helpful, right? Because there's no travel involved and you can fit it into your schedule a lot easier.
Mhm.
Um, and so, but you just lose that person to person relationship building that you have that organically kind of builds when you actually get to meet someone face to face.
Yeah. Do you think that the virtual engagement piece is going to replace traditional face-to-face meetings with that MSLs are accustomed to? Is there a threat, do you think, for that, Karsten?
I hope so not. I think we all value we're social animals, right? And I think we definitely like appreciate those kind of face-to-face interactions. And so what I think will happen is that we live like in that hybrid model world where face-to-face is still like critical for relationship building, reading the room, seeing where the KOL is like coming from. But virtual is definitely like a very effective tool for quick touch points, making like sure that we don't like lose those kind of interactions. So a hybrid is probably like what I see in the future.
I
Gina,
agree. I
anything
think
to
it's
add?
definitely here to stay. I think it works on both sides fairly well, and it wasn't in a way a nice shift because it didn't really exist previously, at least not to the extent that it's available now. And it'll continue into the future.
I mean, that's what I'm hearing across the board. Most of the conversations that I'm having, whether it's with clients or on this podcast, everybody is, I think, in agreement that the hybrid scenario is pretty much here to stay. The big question is, how do you get more FaceTime? That's really the big question. So, and I'm curious as to, how do you see MSLs adapting their strategies in maintaining relationships with their KOLs when there is limited FaceTime? What are some of the things you see people doing?
Yeah, I can take a quick shot on that. I think more so than before, it is important that we are making those in-person meetings count, that we really concise in our messaging, that we really are concise on our values that we provide, so that our KOLs appreciate the time that we spend together, so to speak. And I think the other aspect that we also really have to keep in mind is eventually like to collaborate with our cross-functional partners, right? It's not just like MSL struggling with time in front of the KOLs, but also like our, commercial, non-sales or sales parts. And so maybe there's also like an opportunity to maximize on KOLs availability and minimize like multiple calls to keep them like engaged and not like annoying.
I can't agree more on that. I think, it doesn't matter if you're a small company or a medium size or large company. There are a lot of pharma employees, and oftentimes there's very few of the really targeted KOLs that we're going after. And so, if they're constantly getting bombarded by messaging from the same company, they don't care as much about your role. They just want a bit more streamlined communication and working with your cross-functional partners. Where is their synergy? Where are you compliantly allowed to engage together? And also sharing the information, and appropriately so. What can you share back cross-functionally so that someone doesn't need to go seek the exact same information out? On the back end, we can certainly streamline that process so that when someone is in front of the customer, that it's, again, valuable to their time.
And we're at this time where there's a lot available to MSLs. There's all these digital tools and platforms that kind of help the process. So how does that play a role in an MSL's ability to maintain or improve a relationship with KOLs?
It's a great tool in your toolbox. Absolutely. You've got to vet the information to understand that it's accurate and up to date. Like, for example, if someone had retired, you're going to want to know that. You need to Google as well, or find some search engine of your choice. It's great to have access to all of those. It can be a bit overwhelming of picking and choosing which one you're going to use. And I think you'll find that there's not one tool that's going to perfectly identify or give you the available information for all of your KOLs. Like, if someone is very active on Instagram, like, maybe your tool doesn't identify that, but you can certainly go find that information. So they're helpful, but you still have to do quite a bit of desk research, I think, to actually have a good, solid profile for each of your KOLs.
Carsten, did you have anything to add? I saw you were.
Yeah, I totally agree. And I think we're living like in a world where we are bombarded with several resource streams. And to Gina's point, I definitely would like to emphasize it is important to really like read in between the lines and what information to use and what not. Mm-hmm. I also would like to add, it's not necessarily always like a tool that we use in terms of preparation, in terms of getting to understand where our KOL speaks next and whatnot. But I think it's also something where we, as an MSL or medical affairs, can potentially be more proactive and see within the compliant realm, obviously, how can we leverage digital channels to reach out to our KOLs and potentially also obtain some insights. So maybe just like something in the future that we can leverage more and more to just really become more effective.
Yeah. And not to throw in a shameless plug, but I've actually had a few conversations on this podcast about some of the AI tools and digital tools and social listening that can be really effective. Social listening podcast was awesome. I learned a lot just in that technique and ability to use that to help with access and developing stronger relationships with KOLs. But getting back to the concept of this more virtual engagement situation, how have KPIs changed or shifted in a world that we see a lot more virtual engagement?
Of course, I think it fluctuates company to company. There's not a universal standard for KPIs across pharma. Some organizations don't give virtual engagements the same weight as an in-person engagement. And while it's true that you can fit in more virtual engagements in a calendar, the same amount of work goes into preparing for those, documenting, recording the interaction afterwards. And there's also other, obligations that you have on your calendar. So it's organization specific, but Karsten, anything?
KPIs have always been a point of discussion and always will be. I think we probably would all agree on that. And I think it comes down what is more important, what we learn from them, and how do we interpret them. One of my early mentors said that to me, if you cannot measure it, you cannot improve it. And that actually resonates with me very well, because I feel like we always look out for how can we provide more value. And so I think the discussion should really be around not really how many interactions you had, how many face-to-face versus virtual, but more sort of like, what is that so what behind it, right? Looking like at maybe the impact that some of our conversations had rather than number of interactions and whatnot. So I think it's still like something that we probably have to really figure out. But to your point, Gina, I think it depends also like from organization to organization.
Yeah. I know it's still, it's still a sore subject. When you mention the M word, metrics or KPIs, it becomes like there's no standard, and all companies do it different. Like you said, Gina, like it really varies across the board. But I know that it has been difficult and it is a bit of a sticking point. And I think what I'm hearing is that I think in this environment where KOLs are so busy that they've become a bit selective in who they want to see and how. So how can an MSL stand out to a KOL and get more, whether it's virtual FaceTime or face-to-face FaceTime?
Yeah, I think that is an excellent question, Tom. And I think there are numerous factors that one should potentially like take into consideration. I think outmost, I would probably highlight, make it a value-based partnership. And the emphasis is like on partnership. It's not really so much how much can I get out of this meeting and bombarding that KOL with question after question to just really like hit, coming back to our previous conversation, to hit my metrics. It's more so, I think, an emphasis on what can I do to make my KOL's life easier, better, maybe reduce like the time burden, be concise in my messaging. And concise in messaging, something that my organization also like focuses a lot on, is that scientific storytelling. It depends really how you convey that message, more so like what the content is that resonates quite often with those KOLs. The other aspect is like being curious, right? If there's like a question, try to better understand where that KOL is like coming from, and make the KOL's maybe challenge or barrier the center question like in the room. Less is more. We all know that. And it's better to underpromise and overdeliver than like the other way around.
And to your point about conciseness, the one thing that we know that they don't want is a data dump. And avoiding that at all costs, because there is a way to demonstrate your scientific acumen in a clear, concise way. And that particularly with storytelling, that lends itself to dialogue and a conversation. And that back and forth is where you have such a great opportunity to demonstrate your knowledge and share that. And I think that's when you become a trusted partner. And then, any request that they have, any ask that they have, like following up on that. Sometimes you can get an answer right away, and sometimes it just may take a little bit more time. But having that ongoing dialogue so that they're up to date about it and they know that someone's working on it, follow through, has a huge impact on building a relationship there.
Good stuff. That's important. I mean, that was kind of I feel like that was kind of the meat of what we wanted to get to. But as you're talking, I think one of the things that I've noticed is in talking to a lot of MSLs is some struggle with the ability to develop relationships with certain KOLs because there's so much virtual engagement. So what advice do you have for MSLs that are trying to develop and maintain relationships, but most of their engagement or a lot of their engagement's virtual?
Do your homework on them. Do your best to understand what they're interested in. What do they spend their time on? Any small things that you can kind of weave into a conversation to show that you're not just looking at them for their opinion, right? Like you're trying to get to know them. You are genuinely taking interest. The curiosity that Karsten said, like, is so important within those interactions. And I think, if it tends to come across that you're just trying to get information to bring back to your company and not really having a true conversation with them, like they're just not going to want to engage on an ongoing basis. But being prepared and being, understanding of where they're at.
I call it like pre-call planning, right? Do your due diligence, do your homework, as you eloquently said. I also feel like virtual is still better than none, right? If the first opportunities are always just, hanging in front of my computer and talking to them, that's an entry point. And then maybe over time, you build like that kind of relationship. Maybe there's an opportunity of a local conference or other opportunities. And then, as we had mentioned already earlier in our conversation, make that face-to-face conversation count. I think even more due diligence will eventually lead you to more impact that you can, have on that KOL.
And how does KOL access differ geographically? Like, are there certain states that are easier or more MSL friendly than others?
There seems to be some regional variance with it. I think, what you'll find is that there's just certain institutions that either have a no-see policy for industry individuals, like they really truly don't want to have any type of dynamic, and so be it, that's their institutional policy. During the pandemic, what we saw was like, there was certainly a huge variance of who had an open door policy and who said absolutely not. And some of that I think is still kind of carried through where, there's certain places that seem to only want to do virtual engagements now. And then I think other areas are a bit more open and love seeing a friendly face again.
I would add, if somebody really listening to that podcast would say, okay, here's the holy grail of choosing like the right territory, I would say, unfortunately, there isn't. I think there are certain regional differences, but they're also nuanced. I think East and West Coast are usually heavily dense with high impact academic centers. And for those that are really interested in clinical research, access could be eventually easier. Sometimes it could also be harder if leadership is already engaged, where they have their conversation, and KOLs then often say, why do I have to talk to you as well if I already talked to your leadership? The other aspect is also with community practices. I think areas where you have like a lot of those more private community settings, it will be in general very hard to access, as we also discussed earlier, particularly if they don't really have or only limited clinical research opportunities. So I don't know, you pick your favorite or your evil, and with challenges also come great opportunities where you can eventually like stand out by coming up with a novel approach. So for all those folks that are listening to that podcast, don't necessarily be turned down by not being maybe in an area that has a high density of academic centers. I think you can do great also in other areas where that's not the case.
Yeah. Yeah, we sometimes hear from hiring managers when we're looking to fill a position, hey, this is a tough market. We need an experienced MSL. Like Boston seems like it's a tough area. New York City can be tough. So I think that like anything else, it's going to vary, but we've seen on our side preference for more experienced MSLs in certain markets.
That doesn't surprise me. I mean, I'm in Philadelphia in the Northeast, and it can be tough for sure. I think with the experience just comes like you have different tools, you have different ways to approach it, and or maybe you have some longstanding relationships, or you just understand how these particular institutions work, and that takes a significant amount of time to really understand what it's going to take to get in, right? Like what are the different barriers, and then you get creative of how can you overcome these barriers. And as long as you can say, hey, challenge accepted, I'm going to face this head on, you'll find a way.
Yeah. Well, and that's, I think that's the key is there's a certain level of persistence that I think is important. I think that persistence and resilience, I think, is really important. I think that we're in a time and a place where I think MSLs, in order to be successful and get FaceTime, need to be proactive. This isn't a defensive game. This is an offensive game. Do you guys agree with that?
For sure. Like you've got to reach out to them. They're not necessarily going to come out to you. So for sure.
Agreed.
What about, is there a difference therapeutically? Would you say that certain disease states may have more challenges in getting access and FaceTime than other areas?
I mean, I've worked in a couple different therapeutic areas, and I've certainly seen variances. Like, for example, in rare disease, like there might not be that many KOLs, right? And with that also comes like they're probably also the researchers, the clinicians. Like there's a lot of overlap in roles, and it's not segmented as much in maybe a larger disease area. I think. In oncology, which I know Carson is in, there's such a high volume of individuals that it seems very different, but although I haven't been in that for a while, so I'll let you speak to it because maybe there are some similarities there.
Yeah, from an oncology perspective, and again, it's probably like just be an N of one, but if I compare my access to KOLs, and I'm in the GI space, and compare that to my lung MSL counterpart, it sounds to me at least that he has a much easier game to play than in my case. But I think it also comes down on what is the portfolio, the pipeline the company has that you're working for. Our lung pipeline is impressive, to say the least. And GI, we're just picking up. So there's obviously more interest to really have those kind of conversation. I think it also comes down a little bit on disease prevalence. I think there are definitely more patients out there with lung cancer than there are with liver cancer or pancreatic cancer. And I think that also somehow plays a role in how many KOL interactions you potentially find.
And I just had an interaction with a KOL who I used to call on, and she commented of like, she's very selective in who she's going to engage with, and it comes back to that value, right? I think no matter what the disease area is what value do you bring to the conversation, to them as a clinician, and if you can figure out what the value prop is, they'll still see you.
Yeah. Well, so let me ask you this. What tips or tricks or innovations or creative approaches might you guys recommend for someone who's struggling to get FaceTime, or for someone who's just looking to get more face-to-face time with KOLs in their territory?
Yeah, I would say in general, think about the person on the other end. What is most valuable to them? Anything that helps a KOL be more efficient, perhaps reduce workload, may improve like their patient's life is super important to them. And if that is not like changed by that interaction with an MSL, then it becomes really very tricky to come up with that kind of value proposition. I think the other aspect, MSLs, we're wearing different hats. And I think we quite often also have to think outside the box. If we are just like trying to maintain the status quo, we will probably not really be very successful. And quite often I say, MSL is just a title and not like a restriction to maybe that entrepreneurial thinking that it's still like within you. And there's not only precision medicine that is like a buzzword and changes like the treatment landscape, but with that comes also like that precision engagement. Gina had mentioned it earlier on. Do your due diligence. Try to really figure out what is the value that you can provide to the KOL and make it really like concise. A lot of other aspects that we have brought up during this podcast already is definitely like setting you up for success like in the future. And don't rush it. Sometimes it's not really that immediate win that shows like the value, the asset that you will be for the organization, but come up with a strategic territory plan and lay it out like for a year, maybe if you can out for like for the next year as well. And you will see that you make big strides in your career.
And jumping on the territory plan and having a really good one laid out, like identify who can help you within your organization, right? What other relationships can you leverage? What other MSLs can you leverage? Like make friends with MSLs in your territory. You'll be surprised at how many times you can help one another out. And also in the due diligence, like listen to the social listening podcast and the AI ones too to like find some great tools and tips. But it's there's been an evolution, I think, in social media where physicians are engaging a lot more, right? And they're actually really, I think their goal is education. They're trying to raise awareness to issues or to diseases or conditions, like, and meet them where they're at and understand like what they're talking about, what they're watching, engage with that. Like, what do they think of it? And obviously scour their websites, but you may find that the institutions also have a pretty strong social media presence and what's being said, what's new, what's innovative, like what can you connect on that someone's interested in.
I totally agree. And I hate to go back in time, but when I was a rep a million years ago, it really was the same kind of scenario. Is every office, every KOL, every practice, there's there's the back door, there's the secret code, there's what's most important to that KOL, what's going to pique their interest, what do they find valuable, what's important to them. And like you said, Gina, by asking other people, other MSLs, cross-functional counterparts, sales reps, TLLs, market access people, anybody that has the same, list of KOLs that they're calling on, they could be really, really valuable to pick their brain and find out what's been working for them. What are the hot buttons, and what could you incorporate into your regular, practice and your engagement strategy. So I just think that sometimes the most obvious thing almost gets forgotten a little bit. But again, this becomes an offensive game. You have to be offensive to do that. You have to be the one to reach out. You can't expect people to call you up and say, "Hey, here's the answers to the test." You have to ask for it. So I mentioned the word valuable, and I can't finish this conversation without talking about value. So can you guys share what MSLs or how MSLs can demonstrate value to KOLs in order to develop that relationship and get them the access that they need really for the long term?
I'll go back to the follow through, right? If like say you're supporting an investigator initiated trial, right? Like, there's a lot of markers along the way, like how much are you, how much can you assist, but like continuing to assist to making sure that the communication is there. If they ask for something, you follow through, you are responsive to them. You're also, anticipating some of their needs as best you can, right? And that comes with the long-term relationship, and then offering that up. Like, I think those are good starting points for sure.
Yeah, you can have a list of objectives, but if you're not like defining and coming up and maybe also agreeing on next steps, there is no follow-up. There is no relationship building. So I think you emphasize a very critical aspect. And I think along that line, in order to help you become more successful, it also starts with you. Maybe reflect and do a quick debrief after every KOL interactions. Have I done my due diligence? Have I defined next steps? Have I really followed up? Because those ultimately are aspects that KOLs definitely appreciate and help them to also be more successful in their life.
Awesome.
Absolutely.
Well, thank you both. This was an amazing conversation. It went fast too. That was like the fastest 30 minutes of my life. I want to thank you both. This was like really helpful and insightful. I actually feel like I need to go back and listen to it again. But but thank you guys for coming on and for joining me.
Thank you so much, Tom, for the invite.
Yeah,
Yeah,
this was
thanks for
fun.
having me, Tom.
Good stuff. And guys, thank you as always for listening to the show, for sharing it with others. Really appreciate you. Don't forget, you can find these on Apple, Spotify. Check us out on YouTube and follow me on LinkedIn. But thank you as always for your support, and we will see you next time. Thanks, guys.
Thank you.